Hi guys, and welcome back to this video. So today I'm going to be answering some of your guys' mom and baby questions that you asked me on my Instagram. So if you're not following my Instagram, go follow it because I do these things quite frequently and sometimes answer questions on here. Sometimes I answer the questions over on my Instagram. So you guys asked a lot of good questions, so I'm just gonna jump right in and start answering some of them. Okay, the first question, what breast pump do you recommend? I honestly don't have a number one recommendation. The one that I'm using is the Spectra S1 and I really like it, so I would recommend it, but I'm not saying that like other breast pumps are not as effective or not as good. The thing I like about the Spectra S1 is that it has a what's it called, a charger or whatever, so you don't have to have it plugged in to use it all the time. The next question is, do you ever let baby cry it out? So I guess this depends on what your version of crying it out is. If crying it out means putting my baby in her room and shutting the door and leaving her for 12 hours no matter if she's crying or not, no, I don't do that. However, do I give her time if she wakes up in the middle of the night to try and go back to sleep? Yes. Does that involve crying sometimes? Sometimes it does. To each their own. Everyone has different opinions on cry it out, but in order to get your baby to fall asleep independently, not every time, but most of the time, there has to be some sort of crying so that they can learn. It's not crying because they think they're abandoned. It's crying because it can be frustrating for them to learn how to fall asleep independently. And once they learn that skill, it's a lot easier. And so it's a lot easier for us now. I will say the first night that we ever did sleep training, Callie, the longest she was awake was about 2 hours. She was not crying the whole time, but that kind of gives you a little perspective as far as like the cry it out. It's not like she ever cried for 12 hours straight when we started sleep training. The next question is, were you afraid to let Callie sleep alone in her crib at first? Yes, not necessarily afraid, just I was like, it was weird because I was so used to having her right here. I felt like I needed to watch her the whole time, just because I was like so used to her sleeping right next to me, and it's like if anything were to happen, she was right there. Even though it's like you're sleeping, you're not really actually like watching them the whole night, but just like the security of knowing that she was close by. So when she was in her crib the first night, I like didn't sleep at all because I just felt like I needed to watch her for whatever reason. I like this question. It says, if you could go back and give your preggo self advice, what would you say? And I think I would say just don't be so anxious to get the pregnancy done. I had a really great pregnancy. I can't complain. I was able to stay super active, and I really actually enjoyed being pregnant. And when I gave birth, I actually kind of had to grieve not being pregnant anymore in a way, because I just really, I was happy to have my baby, but I also like loved being pregnant. So I would say like just enjoy those last couple days and sleep. Everyone said, enjoy your sleep now. And I'm like, well, I'm not really sleeping that well. And then, you know, but it's different. When you have a baby, you have to attend to that baby. When you're pregnant, if you're not sleeping well, you can at least lay in bed and be lazy and don't have to attend to anyone. What has been the most difficult part of being a new mom so far? I think that's just like worrying about everything. And I'm really trying to not worry about everything because I think worry and fear robs the joy out of things. So I'm really trying to like put things in perspective, and like the worst case scenario is not always going to happen to your baby, and most of the time it won't. So trying to like take a step back and realize that like she's a healthy girl, things are going well, she's happy, and that does not mean that like the worst thing is going to happen to her. Was I scared before becoming a mom? If yes, when did that fear go away? I don't think it ever really goes away. I think you're always kind of like, you know, like I said in my last question, a little on edge and worried because you really care about your baby. Like literally, it's your heart living outside of your body, and you want to protect your heart. You want to protect your baby because like if God forbid anything happens to them, like you just would, like I would die, literally. She is like my everything. And so you want to protect that baby and protect your heart. So that, I guess, makes me always a little bit scared, is you love something so much you're scared to lose it. This is really depressing. The next question is, do you wake up your baby when it's time to feed her, or do you let her sleep? So I let her sleep, and she doesn't eat during the night anymore. The only time I will wake her up is during the day. If she's taking a really long nap, I will wake her up so that way it doesn't ruin her getting too much sleep during the day to ruin our nights, if that makes sense. If she sleeps too much during the day, then our nights are a little bit harder, and so sometimes I have to like wake her up for that, but it's not necessarily to feed her. However, when she was first born, I never had to wake her up to eat. She always woke herself up. But for me personally, I think that if, let's say, I had a baby that didn't wake themselves up to eat, those first like couple weeks when they're growing until they reach their birth weight, or until your pediatrician says, I probably would wake that baby up every 4 hours to eat, at least during the night. But once they've reached their birth weight, then no, I would let that baby sleep. Again, not medical advice, talk to your pediatrician. A lot of you guys asked like how they changed as a nurse after having Callie. How is it being a mom and a nurse? And I think the biggest thing that's changed is I look at my patients as if they are like somebody's child or somebody's parent. Like if I have a patient that's a mom, I'm like, oh my gosh, they're a mom, they have kids. Or if they're a younger patient, I'm like, oh my gosh, they have a mom. And I kind of look at them more in that, like through those eyes, I guess you could say. And not saying like I'm getting more emotional at work or anything like that, but it's given me a new perspective being a mom, and I've carried that with me now as being a nurse. The next question is, do I find myself obsessing over milestones, like rolling, sitting, etc.? And I would say no. I think every baby does things differently, and Callie's more advanced in certain areas than I guess the average baby, and then there's other areas where she's maybe just average, or maybe she's a little behind the curve, but whatever, she's healthy and she's happy and she is meeting her milestones. I don't really obsess over it. For example, she is like 5.5 months and she's rolled like 3 times, and I know there's a lot of babies that are like rolling like crazy and she just doesn't really have interest in it. I know she could do it, but she just doesn't really seem interested in it, no matter how hard I like try to get down and get her to roll and just to see if she will do it. But she's been sitting since like 4.5 months, which is crazy. So I really am not super concerned about it. She seems to be growing well, and I can tell she's learning something new every single day, and so I don't really obsess over those bigger milestones. The next question says, how do you cope with long shifts and being a mom? What if you didn't have family help? So luckily I went down to part-time, so we don't actually need a lot of family help. On days where I'm working, most of the time Jesse's watching her. The long shifts are rough because I don't see her at all on those days, which is kind of sad. But I'm so lucky to have a job where I'm only working 2 days a week. So I have 5 days off where I get to enjoy all the moments with her. And so that's really how I cope with it, is just knowing I have those days off where I have that time. And if we didn't have family help, I guess we just have to figure it out. I don't really know what to say. We obviously maybe need to have daycare, or we'd have to work our schedules differently so that way, you know, one of us was watching her at all times. But I don't really know because we're lucky to have family help. Next question, how old were you when you had your little baby, and did you plan to have her then? I was 24 when I had her, and we didn't necessarily plan to have kids at a certain age. It was more so a certain time frame. We wanted to wait till Jesse, my husband, was out of the military, that we were more established back here in Arizona. And once we it felt like we had enjoyed our time as just a married couple, we did some traveling, and then we're like, you know what, let's start a family. And we did. And so she was planned, but it wasn't necessarily like we want to have a kid when I'm 24 or when I'm 25 or what age. It was just more so a time frame. Next question says, did you ever have problems with not producing enough milk? If so, any tips to help with your milk supply? I actually haven't had this problem, and I'm super lucky, and I feel for those moms that do, because I can only imagine how stressful it is. I've actually had the opposite problem. I've had an oversupply, so I've worked slowly to bring it down to just what she needs and producing what she needs, and I'm finally just about there, not producing extra milk. There's a lot of great resources out there for if you are struggling with low milk supply. I feel like I can't speak too much on it because I haven't had to do it myself. However, some tips that are just know in general, it's supply and demand. So the more stimulation, the more your body theoretically should produce. So pumping extra after your baby eats to do that stimulation, staying hydrated, eating a well-balanced diet. There's different supplements out there, but there's a lot of different things, and I wish I could speak more on it, but I haven't really had to do that luckily. And I feel for those moms that do, because that would be very stressful. Just a couple more questions. Someone asked, when you were sick, how obsessive were you about not getting your baby sick? Details. So if you don't know, I had the stomach flu for like 4 days, seriously. For about 3 of those days, I felt really crappy, and day 4, I started getting better. But for about 5-ish, 6 days, it took me to get back to like normalcy, so to speak, if you know what I mean. And I was a bit obsessive about not getting her sick because I felt so miserable. I was like, if she gets this, one, I can barely take care of myself right now, and then I'm gonna have to take care of her, and it's just gonna be miserable for her and for and I would feel so terrible if she did get what I had. With that being said, I knew that she had already been exposed to it when I started to actually like realize what I had. I was like, she had already been exposed, so if she were to get it, she had been exposed to it, and there's really nothing I can do to take back those germs. So what I did is, when I finally realized what I had, I was very careful with washing my hands after using the bathroom. I was careful with just whatever like I had been touching. I was careful. I really tried to not hold her as much that day. Obviously that's like impossible. And then I also continued to breastfeed her, which I think was the #1 thing that helped, because all my antibodies and immunity could transfer to her, and I think that's really what helped. And then once I was feeling better, I desanitized the crap out of everything. And so I was a bit obsessive, but I also, like, I don't know if it's considered obsessive or not when you just don't want your baby to get sick, especially the type of flu that I had. And one more question. It says, how do you balance being a wife, a mom while working and furthering your education? I don't know. I think you just do it. You're used to your life and how much you can handle and what's important to you and what's not. And I think the biggest thing is I like to always put being a mom and a wife first. My family is most important. It's more important than work. It's more important than working on my education, all those things. And so I try to focus on that, and then when I have time to do other things, I do other things. Like I work on my master's, or like I said, I'm part-time at work now, so I'm not actually working as much as I used to, which is super helpful. I still get to go to work and be a nurse, which I love, and I also get to be a mom and a wife, which I love even more. My biggest advice is just to have those few priorities that you like are really important to you, and then everything else kind of comes second or third or fourth, and as you can do it, you can do it. If you don't have time, that's okay. I hope you guys enjoyed the answers to some of my questions. If you have any more, leave them down below, and go follow my Instagram so that way you guys can see or ask or comment, whatever, more questions if you have any, and participate in these in the future. So thanks for watching, and I'll see you guys next time.